So for this discussion, we'll first go back to Lisa, who has been an unpaid carer for the last 20 years, and she's also part of our lived experience panel and has been involved in planning this webinar.
Thanks, Emma. Yeah, this is just some of my experience around mental health and well-being. Being an unpaid carer can be a very stressful role, especially if you are doing the majority of the caring on your own with little or no support. In many cases of long-term caring, there ends up just being one person who bears most of the burden. This can quickly lead to feelings of isolation and mental and physical burnout. In my case, I originally thought that being a carer would be a short-term issue and that my relative would eventually get better and we would both live relatively normal lives. 20 years on and this still hasn't happened. This leaves you with a feeling of grief as you try to come to terms with the life that you thought you would have, as opposed to what is now the reality and the future. As a carer, you are not only physically looking after a person with an illness or a disability, in some cases having to carry out personal care and administer medication, but you also have to take on many other roles, such as admin skills for all the paperwork involved, telephone calls, advocacy, financial responsibilities, and for this you have to become very organised. There's no training or instruction manual on how to cope with it all, and it can become very difficult and overwhelming and have a negative impact on your physical and mental health. It has taken a toll on me physically and mentally, and I suffer from health issues such as fatigue, anxiety, depression, and insomnia. Carers also tend to neglect our own health needs in favour of the person we are looking after. When you are attending to their needs, you just don't have the time or energy to book in or attend appointments for yourself. It has also affected my work life and financial situation due to not being able to commit to set hours in a job, and not knowing when a crisis will happen and how I will have to respond. Working along caring full time is nearly impossible, especially if you're doing it alone. So this can lead to feelings of worthlessness, a lack of purpose and direction, and loss of hope for the future. Finding appropriate support can be really hard. Little things can make such a big difference. I remember having a visit from a support worker in the early years of my caring role, and it was so powerful that I remember it to this day. This lady had come to see me and not my relative, which hadn't happened before. The lady that came didn't even really speak. She just listened, really listened to me for the first time as I offloaded how I felt and how much I was struggling. I was so grateful for that. Just being able to speak to someone and have them listen to me without interruption was so powerful, and it made such a massive difference. Something as simple as that should be made available to all carers. I also joined a carer support group, and that really helped me break down the isolation that I felt. Knowing that I wasn't on my own and listening to others sharing the same difficulties really helped me to keep going, and would even find things to laugh about. I would recommend support groups to any carers who are struggling. Other things that have helped me are learning about things like stress management, problem solving, relaxation, breathing techniques, and meditation. Some things I wish I'd known earlier in my caring role is how to pace myself better, what to just let go of, and how to pick my battles more carefully so that I could conserve my energy for what really mattered. I think I wore myself out very quickly trying to cope with every crisis. I soon learned that another crisis will soon be coming along soon enough. Things that I worried about back then don't seem so important now, and I wish I could have had someone around who could have told me this. Taking a break is very important for a carer's mental health and well-being, but it's something I haven't managed to do very well over the years. Many carers cannot leave the person they are looking after, and adequate respite services are few and far between. So many carers don't get a break, which can lead to a burnout or a crisis. I have also felt guilty just thinking about doing something that I enjoy, as I always felt that if my relative wasn't happy, then I couldn't be happy either. But I have learned that helping myself is a coping strategy, and so it is beneficial for them too. And it doesn't have to be a long break or a holiday. Just taking a small bit of time in the day for yourself can make such a big difference. It could be something just as simple as watching a TV series that you like, sitting in the garden, reading or listening to a good book, or taking a walk round the block. All these things add up and help you cope. And so I'd like to ask a question for Neil Grace, who will be speaking soon. And that is, what support does Greater Manchester Mental Health offer for carers? And is there more that you or other carer services could offer that they are not doing currently? Thank you.
Right. Thank you so much, Lisa, for sharing your experiences again. It was really insightful and interesting to listen to. So we'll now move to our final panelist, Neil Grace. Neil is the lead for service user and carer engagement at Greater Manchester Mental Health NHS Trust. Over to you, Neil. Thank you.
Thank you, Emma. And yeah, thanks as well, Lisa, for sharing your experience. I mean, just thinking of what you were saying there, as well, all the stuff you do as a carer, and it's the list sort of goes on and on, doesn't it? It's inexhaustive, I think. And I think for me, particularly for mental health carers, where you're caring for somebody with their mental health as opposed to a physical issue, and it's not as visible, is it, as pushing somebody around in a wheelchair and so on. So I think it's really, really important for me that mental health staff are able to, a big part of my role is sort of training for our staff to make sure that staff are able to identify who these key, meaningful people are in the lives of our service users, people accessing mental health services, and able to support them in their own right and listen to them and involve them in the care of the person. I'll really, really quickly just give a really quick overview of who we are at GMMH, Greater Manchester Mental Health, for those of you that don't know. So we're one of the largest specialist mental health providers in the country. So we work across quite a big area, providing both inpatient, so when somebody needs a hospital stay when they're poorly, around the mental health, but also community-based mental health services as well. And that is across the city of Manchester, but also Bolton, Salford, Trafford, Wigan, and beyond, really. In addition to sort of mental health services, inpatient community in those areas, we also have quite an exhaustive list of specialist services as well, including some addiction services across Bury, Bolton, Salford, Trafford, forensic services. We've got one of 3 mental health and deafness units in the country, a number of prison services as well. So we're a big organisation. We have over 7,000 staff. We work from I think it's 109 different bases across GM. And we work with approximately 97,000 patients a year. So really, really big footprint. So I think my role is to support services to identify carers, involve carers in care, and support carers in their own right, as well as we've heard from Lisa and I think everyone's alluded to it in their discussions. Caring for somebody, whether it's around the physical health or the mental health, has a massive impact on the carer and their own mental health, physical health, well-being, and so on. One thing I really wanted to touch on, which some of you might not be aware of, some of you might be, is our Recovery Academy. It's a fantastic resource. So Recovery Academies came over from the States about 35 years ago. It's effectively a college, a recovery college, that you guys, anyone on the call here, can access for free. So it was founded in 2013. We've got over 2,500 students, service users, people accessing our services, but also their carers. So carers, family members of people accessing mental health services, members of the public, professionals from other organisations can access. more than 60 face-to-face courses, and over 200 digital resources. So it's a really good support for a lot of people. It's good for the patient. They might be on a waiting list while they're waiting to be seen for their mental health, as opposed to just having deteriorate and the impact be on the carer. They can access some really, really useful courses around, to learn about a particular diagnosis, how to live well with whether it's dementia or but carers can also access any of the courses as well. Really, really useful. Digital resources as well. We're aware that a lot of people can't access face to face, or because they're a carer, they might struggle to access face to face sessions. So we've got a lot of online sort of e-learning you can access. We have one called Caring for Someone with a Mental Health Condition or Addiction. So it's got loads of information in there about how to manage in difficult situations with the person you're looking after, your rights as a carer under the Care Act, your loved one's rights under the Mental Health Act. So there's a lot of face-to-face training that you can access. There's online learning. There's self-help resources. I know that a lot of carers will get these resources and actually share them with the person they're looking after to help them manage their own mental health better. Things like managing sort of negative thinking and this, that, and the other. We've got there's a radio station, podcasts around mental health and so on. So that's really, really useful. And I wanted to make sure that people were aware of that. Also on our website, so if you just Google GMMH for Greater Manchester Mental Health, you'll get to our website. It's the first one that comes up. We have some carers pages there. So a big part of my role has been over the last 9 years, since I came to post, it's been going out speaking to carers about what sort of information they find useful and developing booklets, leaflets, fact sheets. So we've got things like a mental health carers handbook. We've got guidance for carers around mental health services, what to expect, a booklet for carers around confidentiality, information sharing in mental health services, why sometimes we might not be able to share certain information, but what you can still expect. I'm working on a new booklet for carers all around the Mental Health Act and the Care Act and so on. So that's something maybe that is useful to know. As well, I just wanted to use the opportunity to shout out about the website. I mean, there's all sorts on there. If there is anyone on the call and they're supporting somebody who is under GMMH, we've got things like PALS, PALS workers across the trust. So they are really, really useful. So patient advice and liaison services. If you feel the person you're supporting isn't getting the care and treatment they need, you can link in with PALS and they will help to liaise with that service on your behalf and support improvements in care and so on. I can see Emma's come on now, so that's my place to stop, I think.
Thanks, Neil. I can hear that there would have been a lot more to share about as well, but
Yeah.
hopefully Eve will have some interesting questions and that gives a chance for us all to hear a little bit more about the support available. So over to you, Eve. Okay.
Thanks. So the first question we've got is, how important do you think breaks are to carers? Because a lot of carers feel guilty about taking breaks. So what would your stance on that be?
I think, yeah, absolutely. I'm a carer myself, a parent carer, and it's massive. I think caring has an impact on every single part of your life, doesn't it? Whether your relationships with your other family members and being able to get away is just it's sort of that double-edged sword, I think, because it's tinged with guilt on one half. A lot of people don't want to take that time away because they feel, what about the person I'm looking after and the support? But then on the other side of that, carer burnout and so on is a massive thing. And, a lot of people go on to actually use our services as a patient because they've not been supported as a carer and they develop their own mental health issues. So it is really important. Yeah, absolutely. I think it's really, really important, and I think there's definitely more that could be done. I think a lot of it's, I guess, linked to funding and so on, and putting support packages in place for the poorly person. But definitely, they're massively important and much needed, I think.
Great. Related to what you just said about having something for the cared for, what can be done currently to ensure that those we care for can be somewhere safe, supporting, and stimulating? So for a few hours, perhaps, to allow regular short periods of respite for carers who need it.
Yeah, I think this is coming. I think it's been a long time coming, but some of you on the call might be aware of things like community transformation. There's been a lot of work to, I guess, update mental health services in line with the 10-year long-term plan. There are things like crisis cafes and living well services and things like that popping up all over the place, and they're only going to get better. I think you're dead right in terms of the environment in which people receive care and treatment is really, really important. It has a massive impact. Some of you might be aware of things like Number 93 in Manchester that people can drop into, and there's loads of groups, and it's volunteers play a really big part in that as well. A fantastic place for people to go to, if they might be struggling looking for work, and they can attend things like gardening groups. I've been working with a number of our services to look at recruiting volunteers to help support with things like gardening groups, and we have a really dedicated volunteer workforce as an organisation as well. A lot of carers, but also patients who want to either work in mental health services or just they're at a stage where they're doing well and they want to give back. So our volunteer workforce is really, really important. And a thing we've been really passionate and keen to lead on is developing our peer support workforce. So people with lived experience who are either in a paid role or they're volunteering to make recovery visible, and they can just, even something as simple as meeting up with a patient, a service user, taking them out for a coffee or taking them for a walk in a local park. It has such a positive impact on that person, but also the carer as well. And it is growing across the trust.
So much for that. But another question from the chat, which is what proportion of GMMH work is inpatient and what is outpatient?
Crikey, I don't know the exact percentage. By far and wide, massively, it's community mental health services. We see so many more. Yeah, absolutely. I think it's something, and this is me plucking it out of the air, but it's under 5% are seen in an inpatient. Having said that, it's really important that we still get inpatient mental health services right. A big piece of work that we've done recently for Manchester, which some of you will probably be aware of, is Northview. So it's a brand new mental health inpatient facility serving North Manchester, based at Crumpsall, North Manchester General Hospital. It replaced Park House, which I think was one of the only few mental health inpatient units in the country that still have things like dormitory style bedrooms. Really abysmal. It's not that sort of environment isn't useful for anyone. We actually work with a group of both service users but also carers. Over about 2.5 years, we were meeting on a monthly basis, and their lived experience, carers as well, helped to shape what Northview is now, right down to the name, what sort of layout on the ward, what sort of digital technologies they want to see on the ward to help people get well, what sort of staffing mix they feel are going to be useful based on their lived experience, rather than us as an organisation just saying, we've got some money, we're going to build this, and that's what you're getting. It's really important, as Ben alluded to before, that we're co-producing these environments for people based on their lived experience.
Great, thank you. And a final question for now. With the GMMH Recovery Academy, you spoke about the different things that were on offer, especially carers to help themselves cope and stay resilient. Where are these courses available? Are they in different locations? Are they online? And how available are they, do you think, to carers across Manchester?
Really good question. Thank you. And I think I'll also just add on a little bit in terms of Lisa's question about other support available as well. So in terms of the Recovery Academy, yeah, absolutely. Online resources are available for people who do struggle. We appreciate a lot of people can't get out and about, and it might be due to the caring role and so on. So we've got a lot of the courses do take place online, face to face. Some are based at Prestwich, our headquarters, but yeah, we do try and get them out and about across the trust. So we use community venues. We've got one in Stretford that we use quite frequently for some courses. We've got one Timperley, Redbank. As well, Wigan, Bolton. We try and sort of get them out across, as where we can really. And just some of the courses. I think there are some courses that you can access for yourself. In terms of things like yoga and well-being, an introduction to mindfulness, all that sort of thing. But there's also courses you can access to better understand maybe the mental health condition of the person you're supporting. I think that has a really positive impact on a lot of carers as well. in terms of Lisa's comments on other support available, I think we could always do more. I just wanted to shout out a few things based on what carers have been telling me recently. Lasting powers of attorney, advice on wills, trusts, that sort of thing. We've actually got a talk coming up, so we have them quite frequently with a qualified solicitor, and he comes and speaks to. And this came about from me having a chat with a carer who basically said, "Look, I'm getting to a certain age. I'm not going to be around forever. I'm really concerned that when I pass away, my child, who has both drug and alcohol issues but also mental health issues, is going to inherit my family home, a large amount of money, and I can't see it going very well." So I linked her in at the time with a solicitor, and we looked at wills and trust fund to keep son safe once she had passed away. So we have regular sessions with a solicitor. We've got one coming up. I think it's the last Monday in June at Press Switch. People can get in touch with me and we can book you a place if you want to. But also as well, another thing in terms of support, I would just want to shout out our 24/7 helpline. So until a few years ago, it was an out of hours crisis line for patients, for poorly service users when the community teams were closed. We saw a bit of a gap in this, COVID in particular hit, and it was opened up as a 24/7 helpline, not only for service user, but for carers. I took a lot of calls on that myself during the pandemic when I was redeployed. I spoke to so many carers who wanted to speak to somebody about their own mental health. So you can speak to a qualified mental health professional or ask for some advice specific to the person you're supporting. So basically, you call NHS, it's 111 on your phone, and you select the mental health option. I think it's option 2. And you'll be put through to us locally in Manchester to speak to somebody.
Great. Thank you so much for answering our questions. And thanks everyone for all of your questions throughout the webinar today. I'm going to hand back over to Emma now to close out today's session. Thank you.